Okay, so then we can move further to talk a bit about Clostridium perfringens type A. As you can see here, it's also a pathogen involved in diarrhea in suckling piglets. We have several toxinotypes of Clostridium perfringens. In pigs, the perfringens type A and C are quite important, but today we're talking about Clostridium perfringens type A, which is a major producer of alpha toxin. We have a huge difference between Clostridium perfringens and Clostridium difficile. Clostridium difficile, it's uncommon as part of the microbiota of adult or piglets. Up to 5% of the pigs can be colonized by Clostridium difficile. On the other hand, Clostridium perfringens is extremely common as part of the microbiota of all animals. And because of that, we have a huge challenge to diagnose Clostridium perfringens type A infection, because we have something that is part of the microbiota and it's hard to identify when this bacteria is really causing disease or when it's just part of the microbiota, just there as part of the normal gut flora of a pig. So far, we know that Clostridium perfringens type A can cause diarrhea in suckling piglets and maybe also weaning piglets. But we don't know risk factors, we don't know the pathogenesis of the disease because we are unable to clearly differentiate Clostridium perfringens when it's part of the microbiota, when it's causing disease. So the hypothesis now is that something can trigger the overgrowth of Clostridium perfringens type A, which will produce a lot of alpha toxin, and this alpha toxin will damage the gut, damage the intestine, and this animal won't absorb the nutrients like it was supposed to. So let's take a look at what we know so far about this disease. And this is a very interesting study from John Prescott group, again from Canada. And they were asking practitioners and pathologists about Clostridium perfringens type A infection in pigs. And it was really interesting because they showed that most vets, they believe Clostridium perfringens type A infection occurs in animals between 1 to 7 days old, just similar to what we saw for Clostridium difficile. And they also think about this disease always when they are treating animals with antibiotics, treating piglets with antibiotics, and they are not responding well to this treatment. And it's also interesting to see that they asked practitioners and also pathologists about the level of confidence they had to diagnose Clostridium perfringens infection. And pathologists, they were less confident to diagnose the disease. That's probably because we don't have a specific lesion associated with Clostridium perfringens type A. For Clostridium difficile, I showed that mesocolonic edema and colitis is quite strongly associated with Clostridium difficile infection. We don't have this kind of lesion here. We don't know the specific lesion caused by this pathogen. So that's why because the reason why pathologists are not that confident to diagnose the disease. So moving forward, another study trying to point out if Clostridium perfringens type A was associated with diarrhea in piglets and how to diagnose it. As you can see here, almost all animals were positive for Clostridium perfringens, and that was true for both normal piglets and piglets with diarrhea. So only isolating the pathogen, only by isolating the pathogen, we can confirm if it's causing diarrhea or not. And the same occurs if you test all the toxins instead of alpha toxin. So in the past, it was really discussed if beta toxin would be used, could be used for diagnose Clostridium perfringens type A infection. And as you can see, it can't because we have the same level of this secondary toxin also in piglets with and piglets without diarrhea. So let's move further. And this is another study now conducted in Denmark. They were again trying to see if it was possible to diagnose Clostridium perfringens type A infection only by isolating the agent, the bacteria. And as you can see here, in both pigs with diarrhea and piglets without diarrhea, they had more or less the same positivity for both groups, almost 100%. So again, Clostridium perfringens type A is part of the normal microbiota, so it's hard only by isolating the pathogen to diagnose the disease. So let's take a look how we can diagnose then Clostridium perfringens type A infection. And first, again, get in contact with the lab you're about to send your samples and ask them which kind of samples they prefer or they can use to diagnose Clostridium perfringens. You can collect swab samples, fish samples if you're talking about live animals, and if you're talking about necropsy, we can collect samples from the intestine, mostly jejunum and ileum from these animals. So, to diagnose Clostridium perfringens type A infection, the first step that we recommend is to confirm the absence of other enteropathogens, to confirm that the diarrhea you're dealing with can't be explained by the presence of other enteropathogens. So, testing against Clostridium difficile, rotavirus, enterotoxigenic E. coli, and so on, it's very important. It's a very important first step to kind of investigating the presence or if maybe Clostridium perfringens type A is responsible for the diarrhea you're dealing with. So the second step is to confirm Clostridium perfringens type A is present in these animals with diarrhea. So we have to detect Clostridium perfringens type A. And you can do that by classic isolation or real-time PCR. Classic isolation is more common, but real-time PCR is quite good because, again, you can understand the amount of Clostridium perfringens that is present in the gut or present in the feces of these affected animals. And finally, it's also a good idea to perform gross and microscopic evaluation of these animals. We don't have a specific lesion associated with Clostridium perfringens type A infection, but sometimes we can see in outbreaks, for example, we can see a lot of bacillus associated with the lesions in the gut. So that's also a very good thing to give you more confidence about the diagnosis. So finally then, some take-home messages. First of all, the prevalence of Clostridium difficile seems high all over the world. Clostridium difficile infection is also a subclinical disease in piglets, so it's very important to test neonatal piglets and also include some samples from apparently healthy piglets. The absence of diarrhea or a low level of neonatal diarrhea, it's not enough to imagine you don't have Clostridium difficile infection. So test your animals, but also know the tool you're using. Talk to the lab and understand what kind of tool they're using to diagnose Clostridium difficile, because you need to know the performance of the tools to interpret correctly the results. And finally, Clostridium perfringens type A, the diagnostic is super complex because it's part of the normal microbiota. So try to associate some steps, including knowing if there is other pathogens involved, and maybe quantifying the amount of Clostridium perfringens is also a good idea. So that's all that I had for today. All the papers that I showed here, they are present in this link here in a folder if you wanted to read a bit more. It's also in the material you had in your table, so you can just further read a bit more or get in touch with this paper. Thank you so much.
감사합니다.